Cardiovascular risk in Danish transgender persons, a matched historical cohort study by Glintborg et al. Background. Many transgender persons have gender-affirming hormone treatment, GAHT, which aims to bring sex hormone levels within the reference interval for the experienced gender. Testosterone treatment can cause higher blood pressure and changes to lipid levels. Estrogen treatment could increase risk of venous thromboembolism. The psychological responses to minority stress experienced by transgender individuals might increase the risk of stress-related health problems. A recent study found the transgender cohort had a lower socioeconomic status, which is associated with impaired health. All of these factors suggest that cardiovascular risk may be increased in transgender persons. Aims of the study: to assess the risk of cardiovascular outcomes in Danish transgender persons compared to controls. Methods. This historical cohort study compared transgender persons and age-matched controls. Each transgender person was matched by age to 5 controls of the same birth sex and 5 controls of the other birth sex. The main outcome measure was any cardiovascular diagnosis, CVD. Results. Transgender persons had higher incident rates of any CVD compared to both control groups. They also had higher incidence rates of any arterial CVD. Transgender women had higher incident rates of venous CVD compared to both control groups. 33.2% of the increased risk of any CVD in transgender men compared to control men could be eliminated by removing GAHT. Conclusion and importance. This cohort study found that the risk of CVD was increased in transgender persons and that GAHT in particular elevated the risk of any CVD in transgender men. The mechanism resulting in the increased CVD risk should be further investigated, as this knowledge could influence management during transition in terms of CVD prevention and use of GAHT. To read the full article, please follow the link provided or scan the QR code.